Thanks everyone for joining us for today's webinar. We're looking at an overview of the common symptoms that people experience in multiple sclerosis. I'm Andrea Salmon. I'll be facilitating today's webinar, and Bridie Phillips is online as our presenter today. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present and emerging, on whose lands we meet today, no matter where we're dialing in from. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. It is my pleasure this morning to introduce you to Bridie Phillips as our presenter. Bridie is a registered nurse and she has committed the last 14 years to community health. And Bridie currently works with MS as an MS nurse advisor. The nurse advisor service is available for anybody who wants to call and ask questions, have a conversation about multiple sclerosis, whether it's symptoms, medications, general wellbeing. Bridie and Jane are our two nurse advisors and they're here to help you along the way as required in various forms. So thank you, Bridie. I'm going to turn off my camera and let you turn yours on, and I'll mute myself as well.
Hello everyone. Thanks for letting me talk about these symptoms. So this webinar is very much an overview of the common symptoms in MS. So for some of you, this might be new information, and for others it might be a bit of a refresher, but it's always good to revisit things and see if there's been any changes or suggestions. There's a lot of specific information about these common symptoms on our website, but what I encourage you to do, if something sort of comes up and you're experiencing any of these symptoms that are highlighted today in this webinar and you want to discuss them one-on-one and not necessarily over this online sort of forum, please call MS Connect and ask to speak to either Jane or I, and we'd be more than happy to have a bit of a chat with you. So let's get this on the go. Right. And so this is a little interesting, I don't know what they call that, a graph. Managing MS symptoms, it's all about enabling you to live well, even though you've been diagnosed with MS. And so this includes lifestyle, which is sort of your diet, your sleep patterns, your exercise and your mental health. And it's also about pharmaceutical management and really good symptom management. So let's start with the facts. MS symptoms, the facts. What we do know is that symptoms vary from person to person and they can fluctuate and change. And in fact, they can fluctuate and change in the period of one day. So it's very variable. And not everyone experiences every symptom. Symptoms can be invisible, so fatigue and pain and cognitive function, for example. And there is a definite interplay between symptoms. So we'll sort of go through some of these as the webinar goes on. So let's have a look at the MS symptoms. So this slide very much represents the various symptoms someone with MS can experience. And often where the damage is how these symptoms may be experienced. So it depends on where the inflammation, the myelin disruption and the nerve damage is occurring as to what sort of symptoms occur. So while MS as a disease doesn't have a cure, much can be done to manage the symptoms. Okay, so Andrea, just before you do a poll, let's just have a quick look at the different areas of the brain and the spinal cord. So you can see there the different types of symptoms that people may have. So in the region of the cerebrum and the cerebellum, these are really great words, you're sort of looking at the cognitive impairment, depression, coordination problems and tremors. If you go over to the optic nerve, we're looking about blurred or double vision or vision loss. There can be several things there. The brainstem, we're looking at vision problems, vertigo, speech disorders, maybe sometimes some swallowing problems, and some sensory loss and pain. And if we go over to where the spinal cord is, we can look at things like weakness, spasticity, spasms, bowel and bladder problems, sexual dysfunction. And then the other common symptoms that can occur are fatigue and heat sensitivity. So have a think about that, and I'll hand you over to Andrea to run a poll.
We thought it would be good to find out what symptoms everyone that's online today experiences. So I'll launch this poll that pops up on your screen. And in this poll, you can actually click as many of these that apply to you. So using your mouse, hover over the answers that you want to choose. So the question is, what symptoms do you experience? And the options are, my symptoms are mainly physical, or my symptoms are mainly sensory changes, or I notice that my thinking and memory is affected, or maybe you have other things happening that you're not sure whether they're MS or not. And if that's you, we would love you to pop that in the question area and let us know what other symptoms you're experiencing, because that can form part of our discussion later in the program when we talk about what is MS and what might not be MS symptoms. So I can see that over half the group have voted on that, but I would love a few more people to participate in the poll. So using your mouse or your finger, if you're on a touch screen, choosing the answers there that apply to you. And you can choose more than one if you want to. So a couple more people to vote on that, and I'll close that off and I'll share the results with you. And whether it's encouraging or not, I'm not sure, but it is encouraging to know that you're not alone. So 81% of people that are online today have noticed physical symptoms. 56% of people have noticed sensory change. 44% of people have noticed changes to their thinking and memory. And actually half the group are wondering if their symptoms are MS or not, the things that they're experiencing. So Bridie, let's go through some more of the symptoms, and then we can revisit some of that towards the end.
Cool. Yeah, we will do that. Now, Andrea, I just need to let you know this. I'm sorry, everyone. This is the problems with connections from home. My computer is saying that I might have some network connection difficulties. I'm wondering if I should turn my webcam off.
Well, that certainly helps with internet. So, yes.
All right, guys, I'm going to disappear, but I am still here because I don't want to lose connection with you all. So I'll flick back on a bit later. All right, so we've had a look at some of those symptoms. It's really interesting that, you know, people are experiencing some symptoms that you're actually not sure about. And one of the things that I would, you know, we'll go through all the sort of symptoms of MS, but one of the things that I would say to you now is if you're ever not sure whether your symptom is MS related or not, always go to the GP and get checked out. Because you have MS doesn't mean that you can't have other symptoms going on, and it might be simply that you have an ear infection, or your blood pressure might be a little bit elevated, or you know, you might have an infection somewhere else that might be actually impacting. So, but and if you're never not sure, please reach out and just talk to someone about it and get some advice. One of the things that you may be aware of is that many of the symptoms actually interplay with each other. And so what I mean by that, if you look at this little table, and sleep is actually one of the biggest culprits. So let's just think about this. You put yourself on this big circle and you've got all these things coming on. Now, if you sort of relate a little bit to this, you'll kind of understand what I mean. So if you don't sleep well, that actually increases your fatigue levels. If your fatigue levels are increased, your motivation levels drop and your muscle strength decreases. That naturally increases your pain levels, it decreases your mood, and then guess what? You try and go back to sleep and you have poor sleep. So you've got this complicated cycle of things happening. And it is very, very common to see this interplay. So what we might do is we'll go through a few of the sort of more common sort of symptoms and maybe some little tips. And if anything comes up and you want to ask questions, please pop them in. And if there's sort of something that we can talk about offline, I will give you a call. So just let Andrea know. But let's start with vision, for example. So you can see we've got a little picture there of the eye and some of the things that can actually occur. So studies have actually shown that more than half of the people with MS will experience at least one episode of disturbance in their vision. And they often describe symptoms like blurred vision, colours faded, and apparently especially the red colour. Pain in the eye, either at rest or especially when looking to the side. Or you might have heard of the term optic neuritis, and that can be the physiological cause of the decrease in vision because of the damage or the inflammation of the nerve that supplies the eye. We often see it happening in one eye. We often see double vision, so things appear in twos, usually side by side, but that can also be a jerky movement. Visual field deficits, so you might find a part of the vision's missing in different areas of your visual field. So sometimes up to 50% of your visual field can disappear, and it can also be peripherally. So it might be like the outside you can't see properly, but you can see sort of in the middle section. So some people with MS do experience ongoing issues with their vision and perhaps notice it's a little bit worse when you're particularly fatigued. And this is where we're talking about that interplay of symptoms again. So your fatigue levels increase, so you might find that the vision isn't as great at that period of time. So we need to put some strategies into place to be ready for such times. So you might want to sort of think about even getting a referral to Vision Australia. They have lots of large print like keyboards and kitchen utensils and things like that can be really valuable. You can have exercise charts and all sorts of things that they can actually make recommendations, and you don't need to be using them all the time. But if you are one of these people that is experiencing some problems with the eye, simple things like that can make a huge difference to your quality of life. The other thing that we've really got to think about with visual problems is the impact on driving. You know, obviously we need to consider the safety of yourself and others on the road. So, you know, seriously, if you do have some vision issues, please don't be behind the wheel. If it's transient and it is something that happens for you regularly, that's something that you will sort of obviously get used to, but you do need to get a medical review if it's ongoing. And a lot of our clients actually engage a neuro-ophthalmologist, which is basically a neurologist that has specialised in eye care, and there's quite a few of those around. And that can be really valuable, particularly if vision is one of your symptoms that keeps reoccurring. All right, now we'll look at the physical symptoms. And I noticed a lot of you said you did have physical symptoms. And because there are so many different possible causes for physical difficulties, it's really important that the issue is investigated properly. And that will actually assist in working out what to focus on. For example, you may need to treat spasticity to see an improvement in your balance. So there's a whole range of health and social care professionals that can help. And they're people like physiotherapists, occupational therapists, rehabilitation specialists, even, you know, sort of exercise physiologists, myotherapists. There's a whole range of people out there. MS specialists, nurses, you've got ear, nose and throat specialists. And the reason that we're looking at that is that the vestibular system is often a part of the cause of a lot of our balance issues. You know, an occupational therapist can be really good. They can have a look at your balance, your gait, your mobility, and they can identify your level of impairment, set achievable goals, and identify appropriate strategies to address the issue. Look, it could be something really simple. You know, you might be walking down the street and you're finding that your balance is really off, and an OT can have a look at you and they go, you know what, I'm actually noticing that you're leaning a little bit to one side, or your foot slightly dropped, or your foot slightly turned out. And the solution solution could be as simple as getting an AFO or some sort of orthotic on your foot to balance that up, and that corrects your balance. It makes you less risk of falls, and also saves your fatigue levels and the exhaustion of trying to walk unbalanced. So, it can be something that is really, really simple. Exercise. So a physiotherapist or an exercise physiologist might suggest specific exercises to manage a problem. Some physical symptoms such as spasticity might require medication to assist in the management, and that's something that you can talk to your doctors about. Aids, equipment and adaptation. So a physiotherapist or an occupational therapist can help determine if a mobility aid would help you manage your symptoms. It could be simple, like it might just mean that an OT comes in and has a look at your home and says, well, you know what, I reckon if we move that couch over there or we put this chair here, can be a simple way of sort of accessing your home safely and making things a little bit easier. Or they might be able to actually have a look at your workspace. So there's some really, really simple things that can actually occur to help you. Have we got any questions on those as yet, Andrea? Any of those, the vision or physical?
Well, we've got a question around pain in legs, but maybe that will come up in pain.
Yeah. So let's talk a bit about pain. And one of the things that I will say about pain is pain in MS is really complex. And it can be managed. Can I just say it can be managed? So, and it's a specific sort of management that really needs to take care. So if you aren't getting your answers from this webinar today, can I please encourage you to call and book in a time with me and we can talk one-on-one. And I can talk you through a lot of the strategies and what other clients have found that manages it really well. So pain and sensory changes are recognised in at least 60% of people with MS will feel some level of pain at some time. And MS pain can take many forms. So it's really important to describe your pain in detail when you're working with a health professional so that you can find ways to treat and manage it. Being able to explain your pain also helps family, friends and carers understand this invisible symptom. And unfortunately, it's the person that's actually feeling it is the only one who can see it as well. And to everybody else, it's invisible. Pain is an individual interpretation and it is very real to the person. So it can be either directly due to the nerve damage or indirectly due to MS symptoms. It can also be a side effects of drugs. But having MS doesn't rule out the possibility of experiencing pain due to other health conditions or accidents, just like everybody else. So if you experience pain, it could be because of one of these factors or a combination of several. So if you can imagine, if you've got a lot of spasticity or you find that your mobility and your exercise tolerance is really poor, or you find you're more sort of chair bound or can't get around as much, just that simple lack of movement can cause an increase in spasm and spasticity and tighten up your muscles, and that's going to cause another type of pain as well. So there's a lot of physical causes, but one of the most common sort of pain that we see in MS is neuropathic pain, which is really complex. And very often treating and managing your pain will require a combination of treatments, and they'll be tailored to your own needs, but it could include, your drug treatments, it could be physiotherapy, it could be looking at your posture, it could be complementary therapies, could be relaxation techniques. And your doctor or MS nurse might actually refer you to other specialists to help manage your pain. So pain management clinics, for example, pain specialists, if they're not able to manage it. And we often know one of the things here is that our physical and mental health directly impact each other. And when we're talking about relaxation techniques and chronic pain, my advice would be to also get some counselling around the pain. Someone who is well versed in pain management strategies will be able to help you come up with a plan to offload this pain. Think about it in a different way, how to distract yourself, different types of therapies and mindfulness and things like that to help with. And as I said, if you want to talk about that further, please call into MS Connect and ask to speak to either Jane or myself.
Bridie,
Yep.
there's a question in regard to painful legs. So one day my
Yep.
legs are painful to touch and then okay the next day. Do you think massage would help with that?
Yeah, look, it really depends. Massage is absolutely wonderful if you can tolerate being touched. So some people actually get a lot of therapy out of it for lots of reasons. That sense of touch and that the relaxation you get from that can sometimes be enough to overcome some of the pain and the sensory things that you're feeling. But if you're one of those people that have hypersensitivity to touch, you may not like it. But it's not going to do you any harm, is what I would say. And if you want to give that a go, absolutely give it a go. And it's the same with myotherapy, which is a specific sort of massage based on muscle groups. Some people find that really fantastic because it loosens up the muscles and make you feel really good. But again, if you're sensitive to touch, you may not like that. So you're not going to do yourself damage. You're not going to cause yourself any more MS lesions or anything like that, but you might find it uncomfortable. So it's really an individual thing. So my advice, give it a go. If it works, fantastic. If it doesn't, then you will need to look at some other ways to perhaps help with that issue that you've got.
And what about chronic headaches, Bridie?
Chronic headaches come as a combination usually, and that can be related to the drugs that you're on. It can be also the first thing. Okay, let's just step back a bit. Headaches in MS, there's lots of reasons for headaches, okay? So the first thing I would always tell someone if you've got chronic headaches, GP, absolutely. First of all, we want to make sure that you don't have any sort of infection that might be causing it. Secondly, we want to make sure that your blood pressure's okay and there's no pathology behind it that is obvious. So if it is related to your MS and it's related to, like a lot of people get headaches from optic nerves and things like that, particularly if, you've got a bit of ache behind the eyes, and some people actually find they get a little pain down the side of their face from one of the other nerves called the trigeminal nerve. Then you need to speak to your neurologist, one, and explore whether it might be a side effect of one of the medications you're on. But two, don't put up with chronic headaches because it really is debilitating. You need to get onto some sort of analgesic for that. And most people will start off on simple Panadol. Panadol is generally pretty safe as long as you don't take more than 8 a day, and see whether that makes any difference. Some people have actually had to go on to Panadol Osteo, which is, 3 times a day, which is how it's generally taken. But sometimes there are other medications that work really, really well for the headaches, depending on the pathology or the background of the cause as to what we want to do. So, but don't forget, what's triggering those headaches. What I would advise to do, if you've got chronic headaches, start writing down when they occur, what they feel like, how long they occur, what have you done to try and relieve it? Have you used a heat pack? Have you used a cold pack? Have you turned the lights off? Are you sensitive to light? Are you experiencing visual problems at the same time? Are you dizzy with them? Start noting all these things down so that when you do talk to a doctor about it, you've got a really good background to get the appropriate management for it.
Thanks, Bridie.
No worries. If you need to talk about that further, please give me a call, and we can go over that a little bit more and one-to-one in context with what your actual situation is. Okay?
Thank you.
No worries. So heat sensitivity, I'm imagining a lot of you are experiencing this. And in fact, we do know that some people also experience cold sensitivity. Um, However, many people with MS might find that on a hot day or when their body temperature increases after exercise, their symptoms get worse. So this is temporary, and when the body cools down, the symptoms are reduced again. The effect of heat on MS symptoms is not a result of further damage or inflammation in the nervous system. So it is usually a trigger that causes that. So in some people, increases in internal body temperature, even as little as 0.5 degree, can cause nerve conduction to slow down and lead to what appears to be a worsening of symptoms. So usually it's temporary and it will improve as soon as that core body temperature returns to normal. So when we're talking about this, some of the triggers: after a hot shower, it might be physical exertion, it might be infection, which leads to fever, it might be stages of the menstrual cycle, it could be even after a hot drink. All of those sort of things can increase your core body temperature. The time of day can also have an impact on fatigue levels, as the body has a natural temperature cycle. It's called the circadian rhythm, and our internal body temperature may vary as much as 1 degree throughout a 24-hour period. We're very complex human beings. Nothing's really straightforward. So for most people, body temperature is highest in the afternoon, and that's a time when people with MS usually feel mostly fatigued. So if you are one of these people that experience heat intolerance, try and avoid exposure to hot showers or saunas, hydrotherapy pools. Now, I'm not saying don't use hydrotherapy pools, but you need to be really aware if you're one of these people that seem to be okay, long periods exposed to these sort of triggers will actually increase your heat sensitivity, and you're going to notice that some of your symptoms will increase during this period. So have a think about it. If you are one of these heat sensitive people, what sort of things are you doing that might be increasing that, and what sort of modifications can you make to improve that symptom? So just have a little think about that one. I'm going to talk a little bit about fatigue. Now, I love this picture of fatigue. And I'm gathering, talking to many of you out there, a lot of you will experience fatigue, and this is exactly what you feel. Fatigue feels like being weighed down, as if you're trying to walk up to your neck in a deep, muddy river in heavy, wet clothes, carrying shopping bags full of rocks. Yeah, that's exactly what it is. And unfortunately, it's one of those invisible symptoms you experience and other people don't see, and they often do not understand it either. And it's actually one of the most common symptoms of MS, and it can have a major impact on daily life. So the level of fatigue doesn't reflect the severity of someone's MS. So people can experience fatigue that interrupts their lifestyle or prevents them from working whilst having few other symptoms. So it's different from ordinary fatigue. And so you might have heard, at the end of a day, Mum, why can't you get off the couch? You've been at work all day and you get home and, Mum, get off the couch. I need my dinner. I need to be taken to the football. Can't you do this homework with me or whatever? And these people that have got this extreme fatigue are on the couch, and they, just like that picture, you can't talk, you can't walk, you just need to recharge your battery. And other people might say, oh, I know how you feel. I'm really tired too. Well, they don't, because it is different from ordinary fatigue. So fatigue associated with MS is described as an overwhelming sense of tiredness that can occur at any time of the day without warning. It usually occurs more rapidly, lasts longer, and takes longer to recover than a normal sort of fatigue. It's usually disproportionate. So the fatigue of a person with MS experiences is not always in proportion to the activity that they've actually taken or their level of ability. And as I said, it's an invisible symptom and difficult to see, and it can be misunderstood by family or friends. and it can be viewed as putting it on or being lazy. So yeah, it'd be interesting if some of you could just put in the chat if any of you have sort of experienced that and what your experiences have been. And it's important to remember that fatigue is actually a real symptom of MS, and um, it's probably important to try and sort of express that to other people if you can, and to understand that it is real, and try not to deny that it affects you. So just recognize that it is a symptom of MS. You're not being lazy. It is very real, and there are ways to deal with it. So the first thing is to make sure that other symptoms of MS or lifestyle issues aren't impacting your fatigue. So you can discuss these issues with your healthcare team to determine if your fatigue is directly related to your MS or can be managed by making a change to your lifestyle. So an example of this would be including a healthy, well-balanced diet, staying active, looking into your sleep patterns to making sure you get a proper sleep. If you remember, we spoke a little bit earlier about the interplay of symptoms and how sleep impacts your fatigue levels during the day. And then if you are fatigued, it's so much harder to deal with all your other symptoms. So it's really important that we get this proper sleep sorted. So if you've managed various symptoms and lifestyle factors that are affecting your fatigue levels, but you're still experiencing these issues, you can then look at other approaches to help you manage. And this includes setting priorities to ensure that you spend the energy that you have on the things that are most important to you. So you've got to kind of budget your energy and make some slight changes so that you've got enough reserves to get you through the day. For example, let's just say you've got a dinner date tonight, and you have a look at what your day entails, and you can see you've got the beds to make, the chooks to feed, the kids to run to school, you've got to go and do the shopping, and then the vacuuming and all of these, and you know that by 5 o'clock you're going to be absolutely whacked out and you're not going to be wanting to go to this dinner party. So have a look back at your day's activities. Which of those can you cross off the list to preserve some of that energy for tonight? So it's about having a look at your daily activity, your weekly activity, and making some changes. So adapting your lifestyle to be able to do those things that you would really like to do and that are essential to do. And there's a lot of information on fatigue on our website, and we're more than happy to talk further about that if you've got an individual situation. And this really leads well into sleep disturbances. Okay, so as we've sort of spoken about, and I think, you know, if we look back to years and years and years ago, I think they used sleep deprivation as one of the nasty tortures in war, because we know that lack of sleep has a terrible effect on our physical and mental health. And we know that poor sleep really impacts your ability to cope with a lot of other things and can amplify a lot of your symptoms. Now, there's lots of reasons that your sleep might be poor. So it could be a location of where your lesions are. It could be pain. It could be muscle spasms, restless legs, frequent visits to the toilet, depression, anxiety, medication. You might actually have a sleep disorder that's undiagnosed. And then, you know, if you're worried or your brain won't turn off, you could be worried about your disease, worried about family, the environment that you're in, and it could also just be a simple stage of life like menopause keeping you awake. So the relationship between fatigue and sleep in MS has been unanimously identified in so many studies, and it is a major contributing factor. So it's really important to have a look at some simple things that you can do is have a look at your routine, you know, your daylight routine as well. Are you exercising? Are you winding down your activities in the evening? So, you know, we know all those things that we should be doing, and we call it sleep hygiene, you know, no screens or stimulation just before you go to bed, reducing your caffeine intake and your alcohol intake. If you've got bladder problems and you are going to the toilet regularly, like if an average bladder should only empty 5 to 6 times a day and maybe once overnight, if you're going more frequently or find that you're having to get up at night, talk to your doctor. Let's address this, because this sleep is really, really appropriate. Get the appropriate referrals, sleep studies. Do you have sleep apnea? Is there another reason that you're not sleeping? If your legs are restless, let's get you something to help with that. If you are depressed or anxious, or your mind will not switch off, let's have a look at some mindfulness. Let's have a look at some non-pharmaceutical ways to try and address that. And if that doesn't work, let's talk to our doctors about getting something in place to help us get into a really regular sleep. So you can train your body, but sometimes we need a little bit of assistance to do that. So if this is an issue for you, can I urge you to please do something about it, because it really, really is important. And as I have said, a non-refreshing sleep can significantly impact your daily activities and exacerbate your symptoms that you're experiencing. Any comments on that so far, Andrea, before I go on to cognitive?
Not really. Someone had asked about sleep issues, and I've also just added that if people want more information about sleep, there is a podcast and there's also a webinar specifically about sleep that would give you more information. But exactly as you said, getting advice is really helpful as well.
Absolutely. All right, so cognitive change. And I guess this is one of the areas that people, you know, tend to not really want to think about too much, but it is really a significant issue. And memory and thinking issues can occur with MS. And some people say their concentration levels falter, making it difficult to complete tasks or find the right word even when you're in conversation. Not everyone will experience cognitive difficulties, but we know that about 65% of MS do have some form of cognitive changes. And some of these changes might be quite mild. Some people might have them moderately, and then some people are actually severely impacted by these. So early on in MS, problems with cognition can have an impact at home or work. In fact, research has shown that cognitive symptoms and fatigue are two primary reasons why people might stop working. And I wonder if any of you have found that yourselves. If you're finding this is an issue, MS has an employment support service for advice. So I always say to people, before you actually, you know, you're at work and you are really struggling with one of these reasons, please reach out and get some advice first before you decide it is time to stop work, because it may be that one of these services might be able to actually support you to stay at work, and you don't need to do that. So it's always worth that discussion. If, as someone with MS, you've repeated difficulties with your memory, for example, forgetting names and places, losing objects, struggling to remember familiar words, a first step might be to discuss these with the doctor. So it may be a symptom of MS, or it might actually be due to other causes. There are many publications outlining practical tips for managing cognitive changes, and some of these briefly include using a diary or other form of memory aid, keeping important things in the same place, decreasing distractions when you're learning something new. Smartphones have been a really great invention. A lot of people are using those to set memories, set alarms, you know, keeping passwords. I know it's not ideal, but you've got to keep them somewhere. So please, you know, and there's also a lot of information on our website and lots of webinars and things about how to sort of help with that. A logical assessment. So you've probably heard of those as a neuropsych assessment. So that can be arranged by your GP or MS nurse, and it can help you untangle the areas that are causing problems, which can actually make treating them easier. So an assessment can try to evaluate your current level of cognitive function, and then once you've identified which area is most affected, so whether it's your attention, recall, or planning, you can be better equipped to determine the most appropriate management strategy. So we're not doing that to see whether you have any psychological disorders. It is really to try and distinguish which of those areas need attention and to help you. So if you're experiencing cognitive difficulty, strategies and tools to compensate are not just useful, they may be essential to the maintenance of your lifestyle, relationships, and self-esteem. And these include trying to explain your difficulties to others, not tiring yourself out, and finding a technique that works for you and concentrating on one thing at a time. So diaries, reminders, occupational therapy assessments, neuropsych assessments, and seek advice.
Bridie, there's a couple of comments that have come in the question area around brain fog and cognitive change, and that's something that I'm particularly interested in. I think a lot of people notice brain fog, but that's not always cognitive change. So we're not talking here about a change in intellect or, people becoming dumb. It's not a change like that people experience in MS. There might be some permanent cognitive change that might be things like difficulty with memory or difficulty with processing that these strategies that you've talked about are helpful with. But a lot of people notice what we'd be more likely to term that brain fog, which is exactly as you described earlier in the presentation, the complex interchange of symptoms. So when someone's feeling particularly fatigued, it's so much harder to concentrate and to focus on a conversation or make a decision. I wouldn't call that cognitive change. I'd call that brain fog. So there's a few things going on in this area, and it can be very challenging for people. But it's important, I think, as you've done, to just remind everyone listening that there are strategies and approaches for making this easier and more manageable.
Absolutely. And as you said, Andrea, a lot of this goes back to that interplay of symptoms. And one thing I'm hoping that, everyone who's listening is sort of getting the idea that these symptoms do all interplay with each other. And absolutely, look, even without MS, I know that, when somebody is really tired, sometimes you do get a bit foggy, and I refer to it as nana brain. Okay, so you try to think of something and it doesn't come, but when you've got this significant fatigue on top of it, that's where that fog comes in. And you're absolutely right, it is different to the cognitive change. So please reach out and get some management for it, because it can absolutely be managed.
Thank you.
Continence issues. So continence issues are very common symptoms of MS, and they can be underreported. And often they're underreported because people are too embarrassed to speak about it. Okay, so often we find bladder, bowel, sexual dysfunction all come as almost as a bit of a package. But what I'm going to encourage you to do is seek advice. What I want you to remember is that bladder and bowel function are absolute vital functions to keep a healthy body. And when they go belly up and they're not working properly, you can become quite unwell with it. And therefore, it is really imperative that you talk about it. And if you are finding it embarrassing, and I know particular sort of, I guess, older generation, it's sort of really hard, I guess, to talk about these things. And look, the thing is, when you're looking at your doctor, what I say to people is, you've got to remember they go to the toilet too. It is a perfectly natural thing. Even the Queen, uses their bowels and uses her bladder. So you've just, it's just, I can't stress enough how important it is to make sure this is right. And one of the sad things I find about bladder and bowel issues is that people end up socially isolating themselves because they don't want to be caught out having to go to the toilet or having accidents or anything like that. And that's really sad. So why should you be socially isolated? You shouldn't be, because there are things that you can do about it. So when we're talking about bladder issues, so a lot of people find difficult not being able to completely empty the bladder. You might find that you've got a reduced bladder capacity or storage, or it could be a combination of both. So we talk about it as a neurogenic bladder, and bowel concerns can often happen in MS. So, and most of these concerns are around constipation and fecal impaction. There some medications that people are on can actually impact constipation as well, and you need to talk to your GP about that. So I find a lot of people with MS are on regular aperients, and one of the things that we do know about the bowel in MS is that the motility through the gut does slow down. So it is important to address it. And if you are one of these people who do get bound up, let's get you onto something. Let's get this sorted before everything sort of builds up to a point where you're really struggling with it. There's been a lot of research into bladder and bowel symptoms, and we now know that we can effectively manage them, but it is really important that you do talk to your GP or your MS nurse, and I would highly recommend a continence assessment by a continence nurse at a clinic. It's a massive assessment, a couple of hours, but they go through everything. They go through your lifestyle, they go through your diet, they go through your health, they go through your habits in terms of your bowel and your bladder. They absolutely look at everything, and then they make recommendations. Do you need to see a specialist? Is it just a diet-related thing? What aperients to go on? How to manage it? Absolutely important that you do it. And sometimes it's a simple thing as including some lifestyle changes. Maybe you need to have a bit of exercise. Maybe your diet isn't bladder or bowel healthy. Maybe you're not drinking enough fluids. So there's a lot of information. And again, there's podcasts, webinars, all sorts of things on our website. Have a look at those. But if you've got some specific issues and you are feeling comfortable enough to talk to me, please get on to our phone service and book in. Changes in mood and emotions. Yeah, there's a lot going on here, and it's relatively common in people with MS, and it can be related to nerve damage, but it can be commonly related to anger, sadness, stress when dealing with the diagnosis of MS or dealing with the challenges that it can present. So it's not unusual for all people to experience periods of sadness and distress, and this can result in irritability and sleeping problems. So many people can find attending support groups helpful. Sharing thoughts and ideas with people who have a greater awareness of what you're actually going through can be a really positive experience. There's our organisation, we run really good peer support group by phone, online or face-to-face groups. Unfortunately, not at the moment with the face-to-face groups because of COVID, but stay tuned. God willing, we'll all be back there soon. Please call MS Connect if you're not involved in any of the peer support and you would like to be. And it's also important to talk openly with family and friends so that they get a bit of an idea of what you're experiencing. Now, if these changes start to affect your life and they're sort of lasting longer than you expect, please talk to your GP and get some counselling. So you can get a mental health plan through your GP and go and see a counsellor. It's really, really important because I think one of the things people forget when you're dealing with a diagnosis with something like MS, a disease that's not going to go away and can impact your life, you're dealing with a form of grief and loss, and it's really important that you learn how to deal with that. Learn how to deal with your mood changes. If you're depressed, seek support. It is really common, and we see a lot of people with depression in MS, and It's not a bad thing. It's something that you just need to recognize, or you might find someone in your family have actually brought it up with you and said, you know what, I've just noticed that you don't seem to be yourself later. Open up to it, get some help, and when your mood has improved, you may actually find, and we'll go back to that interplay again, you might actually find that your pain levels improve, your fatigue levels improve, and your sleeping improves. So please, please don't hesitate to reach out. I thought now would probably be a really good time to talk about relapses, because you've probably heard true relapses and a real relapse. And it's always good to go back over this if you're really in tune with this. So a relapse is, or an attack, as some people will call it. So it's a relatively sudden episode of either new symptoms or a worsening of existing symptoms that continues for longer than 24 hours. So that means it's not temporary. It's in the absence of fever or other triggers, and it's separated from a previous attack by at least 30 days. Okay. So when we have these real relapses, steroids can rapidly improve this kind of worsening, but they're not always necessary. And I guess if you are experiencing a relapse, we need to let the neurologist make a decision whether you need to do it. And this type of worsening is often associated with a change in your MRI. So if you're having a true relapse, you might find that your neurologist wants you to have an MRI to sort of see what's actually going on internally, because obviously we can't see what's happening with the nerves just from the naked eye. So it's important to know that. But a pseudo relapse, so a pretend relapse, I guess, it's a pseudo exacerbation and a temporary symptom flare up that has nothing to do with the course of your disease, but has happened because you've responded to a trigger. And we mentioned this a bit earlier, like fever, infection, hot weather, hot shower, excessive stress, anything like that. You've gone for a 10K run and you're lying in bed with increased tingling and fatigue, those sort of things. Usually they will sort of go away when the stressor is removed, and usually sort of settle down after a little bit of time. So it's not associated with active MS lesions or on an MRI, is simply a response to some triggers that have exacerbated your symptoms. Any questions on that come up, Andrea?
No, there'll be some questions towards the end, Bridie. I'm conscious also of the time.
Okay, no worries, just checking. Okay. So managing symptoms, what should we do? Okay, so you get some symptoms. So the first thing is to do a prompt response to a change in symptoms or new symptoms that don't settle after 24 hours. So seek advice from your GP, MS clinic, MS patient support programs, or call us as nurse advisors. Notify your neurologist. If your symptoms are significant, go to an emergency department, okay? And do not be afraid to speak up. And I think at this point, Andrea might have another question to ask.
We did. We thought this might be another time to check in with people and run a poll. So our question is, so far through the webinar, we've got a bit more still to go through. Have you been prompted to action? Are you thinking, and if you made some notes and you're thinking, yes, I'm going to follow up with my neurologist, there's some things there that I really need to talk about. Or maybe it's, yes, I think I'll follow up with my GP. Maybe you've been prompted to have a further conversation with one of the MS nurses, whether it's at your clinic or whether it's through our nurse advisor program. Or at the moment, you're still not sure, but you'll give it some thought. This time you can only choose one answer. But again, the same idea, use your mouse cursor or your finger to choose your response to this webinar. And thinking about what is all this conversation prompted you to do from here? Because it's great to listen to all the information, but really we want it to be helpful to you in some way. So a couple more people to vote on that, and I'll close that off and share the results. voting on this poll that's up on the screen. That's great. All right, I'll close that off and I'll share what people said. So actually a lot of people are thinking they're not quite sure yet and they're going to give it some thought. That's okay. Absolutely. A lot of this information is for your continued learning and just your awareness. But then there's a few other calls to action. So a few people are going to follow up some things with their neurologist. A couple of people are going to follow up things with their GP, and a couple of calls to their MS nurses. So that's fabulous.
Excellent. Well, I guess the overall with that is that people are looking at, you know, doing something about the symptoms, which is absolutely fabulous. So if anything, I'm so glad to hear that that's happening. So we're getting towards the end here. So a couple of things that are really useful. Actually, I'll put my camera back on now and we'll see how we go. Hang on one sec. So I am still here. Tracking symptoms. So one of the things that I think is really useful is to keep a symptom diary. So just what that basically means is, when was a new symptom experienced, what it is it different to normal, current medications, what's worked, what hasn't. For example, you could write down in a book, and what this does is, I know when you're sort of, you know, got some cognitive fog, or, you know, or something's going on and your memory's not great, and you get to the doctor and you go, oh, I know I've got pain, I know something's going on and I can't remember. Write it down so you can take it with you. So for example, Saturday the 5th of June, this week, fuzziness in my leg has moved up to my arm, had some pains in my hand also one day, but it's been mostly okay. Mostly feels like both my arm and leg is slightly weaker and fuzzy compared to the left side. Must remember to mention this to my MS nurse on Tuesday. You go along, you've got it all there. There's also a couple of symptom tracker apps that people are using. So there's one called the Simple Symptom Tracker, that's a good tongue twister, or Flare Down. So you might want to have a look at those and see whether you think that they would be useful for you. Where else can you get support? Okay, so look at chronic disease management plans to access allied health, such as occupational therapy, speech therapy, physiotherapy, exercise physiology, mental health plans to access psychologists and mental health support, NDIS for under 65, My Aged Care for over 65, the National Continence Helpline, which should all be on your slide there, absolutely brilliant resource. You can get on-the-spot advice 8 to 8 p.m, and they can also direct you where you could go for further help. Our webpage has a lot of fact sheets on common symptoms, so please have a look at those and some of our webinars. So basically, everyone needs a network of support. So for people with MS, this network of support might include your GP, neurologist, MS nurse, MS Connect, local health services, and others who can assist you in maintaining a healthy lifestyle, manage symptoms, and live well despite having a diagnosis of MS. Remember, you are you, no matter whether you've got, and sometimes you need to make some compensations for this disease on the side, and you need to reach out because there is help and there are some really, really good ways of managing your symptoms. And I'll hand back over to Andrea.
Oh, good on you, Bridie. Thank you so much. There are other slides in your handout pack, but I don't need to go through those. They're just reminders of other services that we have here at MS. But in the last couple of minutes, I would very much encourage people to throw in any questions that they still have that they don't feel have been answered. Pop them in the question area in the control panel, and I'll ask Bridie a couple of the ones that have come through. Bridie, are blackouts or drop attacks that happen mainly for seconds, are they associated with MS?
Are we talking about people who just fall asleep without warning? Is that what we're talking about?
We might need some more information to come through about that, but at the moment it just says blackouts or drop attacks.
Okay, because just recently I've had a few people call in who seem to have symptoms very similar to narcolepsy, which is basically you're sort of sitting there 1 minute, the next minute you're asleep. And there are some articles about that online. So whoever it was that wrote in about that, I'd really like to talk to you about that a little bit further one-on-one. And to see, sort of get a bit more of a background of what's going on. So, and again, anything that's sort of a little bit untoward and not typical of MS, I always encourage people to see their GP, because, you know, it could be something related with MS, but we want to make sure that there isn't something else going on as well. So can whoever that is, please send your details to Andrea. I'd love to have a chat with you offline.
I've got their details, so we can arrange that.
Thank you.
Yep.
Thank you.
A question about salt floats for relaxation. Have you got an opinion on that as a form of relaxation?
No, I haven't personally heard of that, but I know there are a lot of relaxation tabs. I'm assuming that, I've got a feeling, if I'm right, that might be those baths that are full of salt and you're just floating it. Look, it's not going to do you any harm as long as you can tolerate it and the water's not too hot and it's not going to make you really fatigued. With all of these alternative therapies, I have no issues with you trying them. They're not going to do your nervous system any harm, but what they might do is antagonize some of your symptoms if you can't tolerate them, just like the massage with the touch, or if the bath's too hot, or anything like that. So I honestly haven't heard of these particular floats, but yeah, look, if you find out anything more, please send the information in. I'll be curious to know exactly what they are. Have you ever heard of them, Andrea?
No, that's why I asked you, Bridie, because I hadn't heard of them either.
I've got a feeling because there's a lot of these new, you know, in all these spa centres and things, they have all these fancy different things that you can float in, you know, and they add all these stuff. And I've got a feeling it might be just a salt-based one of those. So, and look,
and I would add one of my I guess it is a caution. So one of my cautions around some of these things is that if they're exceptionally expensive, that's a worry as well. You can do a lot of relaxation techniques that don't have to cost you a lot of money. You can download Smiling Minds app and listen to a relaxation technique. But if you particularly like baths, and that's going to actually be something that you enjoy, there's nothing wrong with that.
Yeah. Absolutely. Yeah, enjoy it. Sounds like heaven.
Yes. Someone else has sent in a comment that they have done a salt bath and it was lovely. So absolutely, it depends what you enjoy, doesn't it?
Absolutely.
Someone made a comment about how long should a pseudo relapse last for?
That depends on the activity. So we're saying no longer than 24, 48 hours. Okay. But I have had people who have pushed the limit. So for example, I had a fella that rang in once who used to like to go on an 80K bike ride. And then he was saying, you know, after the 80K bike ride, he was actually in bed for a week. So that's a direct impact from overexerting the body. So my suggestion for that is cut it back to a quarter, see what that does. You're still getting your bike ride and your enjoyment. You're still getting your cardiovascular and your exercise, but maybe it's not going to wipe you out. So we would normally say the typical definition is 24 hours. So theoretically, it should go away. So let's just say you had an infection and you went to the doctor and got antibiotics. It might take a fraction longer for that fever to come down, but you know, you take your Panadol, it should sort of start to settle. So if it's going on longer than that, you need to let someone know.
Yeah, that's great. I think, a comment on, actually, and I can throw in something on here as well, a comment about exercising your brain, helping with that cognitive fog. And my initial comment is that it's really important actually to keep our brains active. There's no direct evidence that doing brain training per se is, it's not like an exercise. So The example I always give to people is it's good to do a variety of things to keep our brain active. If you do crosswords every day, you'll get better at crosswords. But if you do different things, you'll keep your brain active. So it's not about doing the same thing every day. It's about variety. You might want to make a comment on that as well, Bridie.
Absolutely. No, I agree with you 100%, Andrea. It's really important to stimulate your brain. And I know a lot of people who just do jigsaw puzzles and Sudokus and things like that just to keep their brain stimulated. So the only thing I would say is if you are feeling really fatigued at the time, or you've got some visual things and you're looking at computers, maybe not pick a time when you're not experiencing that, because you just might find that you're a little bit more fatigued. But absolutely, jigsaw puzzles are another really good one. Anything that sort of, that hand-eye coordination and stimulates the brain to think.
Yep. And in regard to, again, that cognitive fog and some management strategies, it's a bit hard to go into a lot of detail individually today, but I would again suggest people look at the webinar library for some webinars around around thinking and memory changes, and then managing some of those changes. We've got a couple of programs to help with that, and then individual support is available as well. Thank you so much, Bridie, for your time today, and thanks everyone for being online and the great interaction that we've had. That's been terrific. Again, though, I would just reinforce what Bridie has said. If today has prompted you to think about something that you've not thought about for a while, or it's something new, please follow it up. Don't just leave it as good information for today. Make sure you follow that up and get some individual advice for your situation. There are so many strategies and approaches that can be put in place, but having that individual conversation is where we can tailor that to your particular situation.
Absolutely. Thanks for having me. It's always great talking about symptoms, and don't be a stranger. Please call if you need to, and please, everybody, continue to stay safe during this COVID period, and take care.
Thanks, Bridie. Thanks, everyone. We'll look forward to seeing you at future webinars. Thank you for being with us today. Please stay on the line and do a quick survey to give us some feedback. Thanks, everyone.